Agents, your skin has to be, sorry. Blooper!
That's supposed to be turned off.
So meet Tony. She contacted me for one of the online consultations. She is in her early 50s and she comes from the area right outside of Birmingham, Alabama. And the reason she contacted me is because she has been struggling with hyperpigmentation, namely melasma, over the course of 20 years. Now, she and her husband actually own a catering business, and in the last year now owns a food truck business as well. And it's called Tasteful Touch. Link will be in the description below if you are from that area. Now, in the food truck, there is an oven, a griddle, and a deep fryer. Deep fryer, everything just tastes better fried. I try to eat healthy, but that is one of my biggest vices is French fries. So Tony's work environment revolves around being in high temperatures for an extended period of time, working around the oven, the griddle, as well as the deep fryer. So for those of you who don't know, when you are exposed to high temperatures, whether it's from an oven or you're living in an area that is consistently hot, that can inflame the skin at very low levels and increase more hyperpigmentation. So obviously she is working day in and day out in these high temperatures. So when she came for the consultation, what she was struggling with was the melasma as well as some breakouts along her jawline and her chin area. She also had some congestion along her cheeks. So when we did the consultation and I wanted to understand her skin's history, in 2015 she did microdermabrasion. In 2016 she did laser, and then 2018 she did a series of acid peels to help with the melasma. And she was really frustrated because what she found was in some of those, she did see some improvement, but again, after a while, it slowly started coming back. So here are the products that she was using. So she was using
CeraVe Hydrating Cleanser, SkinCeuticals Purifying Cleanser, DLA Pigment Correction Brightening Pads with 6% hydroquinone, 2 weeks on and 2 weeks off, a skin brightening anti-aging serum with antioxidants and hyaluronic acid, Clean Organics Advanced Retinol Moisturizer, CeraVe Hydrating Moisturizing Lotion, plus SkinCeuticals Physical UV Defense SPF 50, Arbonne Eye Gel, and finally ERA Revive Organics Mask. Woo!
So during the consultation, what I did is I asked a lot about her skin's history and what she used, because the more invasive treatments that you have done or more invasive products that you have done, the more tolerance your skin has become. So in her case, because she has dark skin, she works in an environment that has a lot of heat, and she also does not have sensitive skin according to what she put in her consultation card. It gave me more insight into how we could introduce the products over time. She already understood, based on her skin's history and how her skin responded, that this was a case that she has to manage her melasma. It's going to lighten over time, but it has to be slowly, because the more inflammation that we inflict on her skin actually produces more pigmentation. Now these pictures over here that you can see, this was actually taken, I think, a few weeks, maybe 2 weeks after she started the protocol. So you can already start to see some lightening and more evening of her skin tone. Obviously, she still has her melasma because she's only just a few weeks into her protocol. It's probably going to take months for it to actually really start to even out. But I wanted you to see just how much can be done in just a few weeks. But she already understood, she already came in with the mindset that you have to be patient. So here's a summary of what we did for her treatment. So we replaced her cleansers because her cleansers weren't acidic enough. So remember, her skin is not sensitive. In order for a lot of lightening agents and even antioxidants to work, especially vitamin C, your skin has to be more on the acidic side of pH. So what we did is we changed out her cleansers so we would bring down the pH of her skin, and we wanted to do it slowly over time. And so because it's summertime and she's probably doing a lot more catering events outside outside. I wanted to actually do it slower, make sure that her skin got adjusted to a lower pH. So by the time we got into winter, we could introduce a little bit more stronger products. So we changed out her cleansers. We also had her not use those brightening pads because they had some exfoliating agents. And instead, I had her use a rinse off exfoliating product. So that way it doesn't stay on her skin. We introduced this age reverse brightening serum, and this is actually a lightening serum. So there's a blend of two types of mushrooms, reishi mushroom and shiitake mushroom. These are Japanese mushrooms that have been shown in clinical studies to have brightening properties. They're tyrosinase inhibitors. So tyrosinase is an enzyme that we naturally make and is needed in order to turn the melanin brown. So it prevents that. It's a tyrosinase. It's considered, there's many tyrosinase inhibitors in there. So I introduced that into her skincare regimen. Now, it's not enough just to have that. So on top of that, we switched out her sunscreen to use a sunscreen that also has ellagic acid, epigallocatechin, as well as raspberry extract, which is from the ellagic acid. So tyrosinase inhibitors also in her sunscreen. So we will keep you updated on Tony's progress because obviously it is going to be a slow, results-oriented skincare protocol just to make sure that she is not having too much inflammation on her skin, because again, prolonged inflammation can lead to hyperpigmentation, and because she already has melasma, it's going to be a slow process. So we will keep you updated on that. So if you are struggling with melasma or a skin condition such as acne and you've tried everything, you don't know what skincare products to use, nothing seems to be really working, it could be just a case of that you're neutralizing the pH and we may need to just switch things around. So in our consultation, we talk about your skin's history, your lifestyle, what you're doing day in and day out that you may not be able to, have too much control over. And we will design a skincare protocol specifically designed for you. The link will be in the description below. And if you're struggling with really difficult melasma, you can watch the 3 Truths About Melasma here. And remember, makeup is an art and skincare is a science.